Hi guys, thanks for being with us on another episode of Emergent Leadership. I'm fortunate enough to be with Dr. Justin Fairless this morning. Justin, how are you?
I'm doing great. How are you?
I'm well, thank you. Thanks for being on. So, you know the kind of name of the game. We're talking about leadership. So I wanted to bring you on, and for those of the listening that don't maybe know you and your story, why don't you tell us a little bit about your path to leadership, where you are today? Maybe got a few roles, but in traditional physician form. But I'd love to know a little bit about what you're doing today as well, if you don't mind.
Sure, absolutely. So I started out doing EMS in the Central Texas Waco area as a paramedic, and then went to medical school. Well, I was actually in college at Baylor at the time. And then I went to medical school in Tulsa at Oklahoma State, and residency down in Corpus Christi in emergency medicine. And then I moved back to Tulsa, and I took over as a medical director for several EMS agencies, including Tulsa Life Flight, as well as some local fire departments and grad EMS agencies. And I stayed with their parent company, Air Methods, and moved down to Texas and continued to do air medical EMS in Texas and New Mexico. And I currently live in the Dallas-Fort Worth area and practice emergency medicine in the Fort Worth area. And then I still do air medical transport, medical direction primarily. I have also had some time with EMS education. I worked as a medical director for an EMS program in Tulsa, and I have had students rotate with me in the Dallas area as well. I have worked both on the Dallas side as well as the Fort Worth side with medical students and residents as well. And I recently took on a assistant professor role with a medical school at TCU, where I'm actually teaching the undergraduate med students before they start clinical practice. And then my primary passion has always been EMS. I started out doing that when I was a freshman in college, and I continue to do EMS medical direction and practice EMS medicine as kind of my first love, and then emergency room, emergency medicine as well.
Well, it sounds like no shortage of stuff going on. What do you do when you in your free time? I'm sure you don't really have much of that with all the roles you're in.
That's true. I mean, I have 3 young kids, but they know that we may be out camping, and I'm going to get a call from the satellite phone from one of my aircraft at 3 a.m. in the tent. So
sure.
Certainly working all the time, but I spend as much time with my kids as possible as well.
Right, so. Right. Keep it interesting. That's awesome. So you do a lot of different roles. You've done ground, you've done air, you're in a hospital emergency room. Now you're breaking into a physical classroom, I guess as physical as we can get it these days, on a Zoom. So what drives this interest in emergency medicine for you? I mean, the title of the show is obviously Emergent Leadership, but what's the draw for you?
Well, for me, like a lot of emergency or medical practitioners in general, I developed that at a young age. When I was in high school, I had one of my cousins. It was a captain with the Dallas Fire Department, and I actually rode out in the ambulance with him in high school.
Okay.
And immediately after graduating high school, I took an EMT class, and I started working on the ambulance in college. And I had wanted to be a pediatrician or a surgeon, but bringing patients to the ER and doing pre-hospital care solidified my love for emergency medicine. And of course, I had always been kind of an adrenaline junkie anyway, and that of course continues. It's kind of one of the prerequisites for practicing emergency medicine or EMS.
Yes.
But it was something that started in high school, really, when I got into EMS thanks to a family member.
Yeah, how funny. I think there's so many people that I talk to that have a story like that. There's this one time and it shaped their career, and it's just one time they were in the back of an ambulance or they rode on a truck. And so I love to hear that your story is not different than so many others that I've spoken with. So you spent some time in Oklahoma. So for those who aren't from Texas, it's like, the Oklahoma Texas thing is kind of funny to me. You go up to Tulsa to do medical school. Got involved in EMS there. So came back to Texas and now again in a couple different roles. What is the leadership side to you? Obviously, you're learning and you're growing along the way, but what is emergent leadership in your eyes?
Well, my mission or passion has been more than just taking care of one patient at a time, and certainly I want to do things where I help the greater patient population. But early on in my career, it has been more of the education side, having medical students, paramedic students, PA, nurse practitioner students rotating with me in the emergency department, and kind of passing along my knowledge to them. It's part of the tradition of emergency medicine training. You see one, do one, teach one, and having the opportunity to teach someone something and pass it along and kind of hand it off to them is something that I have always been passionate about. It may go back to the fact that I have parents that are educators, and it is something that has started out with residency, where you're teaching other residents, and that's just kind of part of the way it works. And then I got into the teaching of paramedic students, and of course, with knowing that EMS was my first passion, I quickly latched on to that. I'm like, paramedic students are really excited learners. A lot of times you get medical students that are kind of burned out from all the training they've been doing, and maybe not as eager all the time. Back then when I started, work hours were a little bit different now, but fortunately they have some work hour restrictions now for residents and med students, but they didn't back then. But paramedic students don't get as much time, and so that time is precious to them, especially when it comes to procedures. It's something where they really fight to get that hands-on education as much as they can. I tried to do that in my practice, and with my agencies in which I was medical director, I actually got my crews into the ER and let them spend time with me. For all of my new hires, they actually got to rotate with me and intubate and start lines and chest tubes and all that. That's very important. Obviously, we're seeing a lot of this stuff has gone virtual, and this was even before the pandemic occurred. But there's a lot of SimMan and virtual online things, and honestly, nothing beats hands-on and in-person education. We certainly, can learn and do a great job with the Zoom and the virtual learning and the SimMan, and certainly that's one great aspect. But there's something different about physically being there and being thrown into a live patient situation, and having your student stand there and you stand back and let them go. And it's just exciting for me, and it's certainly exciting for them as well.
Yeah, I like that phrase. They're excited learners. And I don't know if this is common in your world, but see one, do one, teach one. I love that. So it's not only that hands-on, but it's that philosophy of you have, like I said, an obligation. I learned it, and now I have to show it, and I have to explain it. And I think that's really incredible that you're able to bring in. You have the partnerships both ways, where you can bring your students into kind of your two worlds colliding and be able to find the benefit of both. So I am curious to know, Dr. Fairless, as you're teaching and you're educating in a hospital environment to, paramedics, right? Paramedic students, or in these kind of crossover environments, have you had any challenges specifically in leading them? I mean, personally, I'm sure that's a challenge for you, being in a different environment. Tell me about a time where maybe it didn't, go exactly as planned, or maybe it was a really great outcome. Can you share a story with me from maybe one of your experiences in that crossover education?
Well, of course, you're in a different setting in the hospital. When you're obviously in the pre-hospital setting, you may have a very busy shift, or you may have one that's not. And emergency department's the same way. It's just more of a controlled environment. But it all comes down to the interest level and the passion of the learner. You may have someone whose lifelong goal was to do pre-hospital care, and they're very excited and passionate, and they're asking you questions the whole time, and and they're wanting to learn. And then you may have someone that's doing this because someone made them do it, someone pushed them to do it. They don't really want to be there. Maybe they're on their cell phone the whole time and not paying attention.
Right.
And so they don't get the opportunity to learn. I think that the big part of it is that when the situations that I remember are when I have a student that comes in and immediately off the bat they just start asking all kinds of questions to me, and they clearly show me that they want to learn, and then they get that opportunity because we spend a lot more time talking. If I have a student that comes in and seems disinterested and is not really wanting to say much, then they may not have the opportunity to do as much either, just based off of that. And so it's a potentially valuable experience, but it does require the student's engagement as well. But I mean, there are cases where we have a freak day and we have 3 intubations in a row, and this student gets all of them, and they may have a classmate that never got a live intubation except for on a mannequin. And so it's just like everything else. It's going to be hit or miss, but I really enjoy getting opportunities for students to do those kind of things.
Right.
But there's the didactic component as well. You have the opportunity to sit down and we can just sit there and chat during the course of a shift, even if we're not busy, and delve into certain topics and concepts. And I just enjoy the conversation on the scientific aspects of pre-hospital care and emergency medicine, and just kind of talk for hours on those things.
Sure. Yeah. And so have you seen that in having those rotations, it has helped you build personal relationships in those environments?
It definitely has. And I've certainly kept in contact with a number of my students, and whether it be writing recommendation letters for them getting into medical school, or maybe working alongside them in EMS and having them eventually become an EMS leader, a supervisor, or an educator within one of my agencies. So certainly it has continued on past the training time.
So, and you think about your career, and like I said, the different kind of pieces you do in your mind. Do you compartmentalize them the way that maybe I'm talking about it? Is it like, this is my hospital job, now I'm going to go do this EMS stuff? Or does it all kind of blend together for you? How does that feel and look, being a part of so many different emergency medicine environments?
From an outsider's perspective, I often get told, you have so many jobs, when do you have time to sleep?
I might have said that 20 minutes ago.
Well, the answer is I sleep every other day, and it's for 6 hours or less. But that's what an espresso machine is for.
I mean, I hear you.
But in reality, it's all a continuum. Emergency medicine is a continuum, starting from the initial event that happens outside the hospital to the patient being admitted or discharged home. And so I may be working in the hospital. I get a phone call from a helicopter for medical direction, and I may get an email asking to be a consultant on a case or something like that. And it's all related. It's all the same thing. It's all emergency medicine practice. It's just one is in a different setting than the other. But it's all the same mindset. My brain is working the same way, whether it's a patient in the hospital, it's a retrospective review of a medical case, or it's a call for a scene call on a highway accident and taking care of them there. It's all a continuum for me. But yeah, you look on paper and it's a long list of different roles.
Yeah. Well, I'm kind of joking with you in the beginning about how do you sleep and where do you sleep. I think that's a common question for a lot of EMS leaders and emergent leaders in general, is that you dive into what you do and it really does kind of consume your world. And I think that that's one of the conversations that we need to have as an industry too, is how do you create those barriers and protect yourself against that so that you are delivering the best patient care. You are being, showing up to be your best every day that you can. But what I personally love and appreciate about it is not, hey, I'm working 8 jobs. It's a very entrepreneurial spirit to say, I have this skill set. How many places can I apply it and add value? And that's how I kind of see people like you, people, and I'm the same way. I've got this thing. Who needs to hear about it, right? I've got this thing I've learned. So who can I show it to? Who can I share it with? And I see and feel that in you. So when you're talking about, my background is a little bit different. I have some exposure to the aeromedical side, definitely not from a medical perspective, not from a clinical perspective at all. But as you're talking about kind of ground and air and hospital and pre-hospital, I think there's a lot of words in my experience that are like sensitive points for people. People, they get upset if you call EMS healthcare, right? Because it's EMS. It's not hospital. It's not health. It's a different thing. Do you see any of those sensitivities, or have you come across any of those things that you're like, I don't get this?
Well, first of all, back to your previous point, obviously being in emergency medicine, but particularly air medicine, the whole value of getting sleep and rest is not only important, but it's a job requirement. And in fact, there are certain specific requirements that we have in air medicine that are much more strict than even ground. But having been a former EMT driving an ambulance across the state of Texas, I can tell you that sleep is important for driving an ambulance just as much as it is for being on an aircraft.
Right.
With that being said, there are certainly some negative connotations when you use things like the word healthcare, and I think it's mainly because of the insurance, regulatory, administrative, healthcare executives. There's a lot of negative connotations that come into that. Certainly EMS wants to be their own entity, but you're absolutely right, especially with us having the big increase in mobile integrated healthcare and doing healthcare in the pre-hospital setting. This has become more important, but yes, every single first responder is part of the healthcare system. Even non-certified first responders, volunteer firefighters, police officers that arrive on scene and provide first aid. That's the beginning of the healthcare system. And so whether or not they like it, the dispatch, emergency medical dispatchers are part of the healthcare system. Now, they may not want to call themselves healthcare, but they are. Technically, that's what they are. I just think that, they want to maintain their own identity and be separate. They're definitely not part of the hospital, but then again, there are EMS agencies that are hospital based and they are part of the hospital. And in fact, with Tulsa Life Flight, they used to be a hospital based, and they would actually work in the ER during their shift and come out and go on flights. Mm-hmm. Now it's gotten more community based, and we're at airports or maybe at a hospital, but at a station outside the hospital and not really interacting with them. And it's not as integrated as it used to be. But we're still all the same team.
Sure.
All the way through.
Well, and I think, the patient care, you talk about where that starts, and you even mentioned law enforcement, which I think is fascinating, because especially, whether it's today's world or 10 years ago or yesterday's world, the scene, when you talk about somebody who spent time in incident command spaces or emergency, disaster response, or the team, and who you call your team are the people that are there and they're in it. So it's interesting to me because you see a lot of technology companies now trying to fill the gaps of those scenes, right? The scene on the side of the highway, the scene at someone's home, into the scene in the back of the ambulance, into the scene in the emergency department, up through the scene at the ICU, or wherever that patient's healthcare continuum kind of takes them, where it takes them. So it's I think that's one of those things that depends on who you're talking to and what it means to them, on how it kind of hits. I was on LinkedIn the other day, and there was some conversation about this, and it was kind of sparked a thought for me. They were like, what do we need to be doing as an industry? One of the consultants in the industry said, what do we need to be doing as an industry, knowing that healthcare is changing, the face of how we deliver healthcare is changing? What do we need to be doing to basically stay relevant? And I thought to myself, look, I guess that depends on who you ask. right? And what they consider EMS to be. Because when you're talking about what does EMS need to do to be a part of the conversation about healthcare, whether that's, to your point, payers or hospitals or, accountable care organizations or, physician groups and medical direction that drive how the care is delivered, whatever that looks like. I always find it fascinating because I would argue, Dr. Fairless, that EMS is in this big identity crisis. And the fact that you can't say, are we healthcare, yes or no, to me is what drives a lot of the challenges in that integration from a clinical standpoint. But maybe that's just my outside perspective. Do you see that when you've got people that are adamant that we're not part of healthcare, that there's that breakdown?
Well, certainly when I first started with EMS medical direction with a couple of smaller fire departments, where we would transport patients and bill for transports. If they were a no transport, there's no bill.
Right.
And it was essentially free care, except for maybe a monthly payment that citizens pay that's a small amount. Pretty much their entire livelihood was a transport to the hospital. And that was it. And then, of course, we pushed for getting the no transports billed. And then we start talking about what about some sort of system where we go check on the repeat frequent flyers and go actually do something where we go to their house and check on them.
Right.
And then you start getting into the whole entire aspect of the mobile integrated healthcare, doing some sort of treatment outside of the hospital without transporting them to the hospital, or is it taking them to an alternative location rather than an ER, whether that be some sort of facility, a sobering center, a dialysis center, some sort of clinic. Freestanding ERs come into play, urgent cares. And so it starts to expand. And so certainly there are certain EMS agencies that are having a crisis where they're not ready to do that yet, whether they have seasoned veterans who are not used to doing more than 2 or 3 calls a shift, and that's just kind of their lifestyle, and they just want to go to certain types of things, to you have some of your EMS professionals who really want to improve the entire community and help out the entire healthcare system, and want to do what they can to prevent frequent calls by doing some sort of other thing outside of just simple transport to the hospital. And so you have all kinds of different spectrums there, and you have some where there are whether they be physicians or nurse practitioner or an advanced paramedic that is responding to a home and doing suturing, prescription medication, something at the scene where they don't transport them to the hospital. And so I think you're going to see more and more of this. I mean, this dates back to when I was back in Tulsa. We constantly had hospital surges where ambulances were waiting for a prolonged period of time for beds, and we were looking for ways to keep patients from coming to the hospital. Now, during the pandemic, we've had this period of time where we're saying, hey, guys, go ahead and come on back to the hospital. We know you're not calling 911 or coming because you're afraid of COVID. And of course, you're having your increased number of cardiac arrests, strokes, and heart attacks occurring at home and not presenting to the hospital. That's going to change, and it's going to come back. We're going to go back to where we were before. But we're going to continue to have to look at what are ways where EMS agencies can survive outside of just simple transport to the hospital, especially if insurance companies are going to continue to do their thing where they are paying less and less for transports.
Right.
And so it's a financial thing, but it's also an identity thing. Are we just ambulance drivers? Is our job to just move a person from point A to point B? Is our job to take care of emergencies? Is it to actually improve the healthcare system as a whole? And is it community service to improve the community as a whole? And so what kind of agency do you want to be? Do you want to be someone who is known for making the city a better place? Or do you want to be known as the person who is just a taxi driver? So which direction are you going to go with your agency? So hopefully it's the first one.
Yeah, well, I know that the third one will make people's blood boil and get up in arms. We'll get all the comments. So, A for engagement. You said that the bad words, the ambulance driver, which is so funny because
Yeah, and I used to be one, and I used to be called one. So,
right.
I've been there.
Yeah.
And so I know the words that trigger people, and but the point is you don't want to be called that, and so don't be that.
Right.
Be something more than that.
Right. I love that. So, I mean, I almost hate to ask you for a takeaway because that's such a strong takeaway. Be something more than the things people call you, right? But I'm going to anyway because that's how I operate. So, obviously, you're an emergent leader, Dr. Fairless, and you've been in environments and you've done all sorts of things yourself, and you're obviously passionate about education. But someone listening today, they're not in a physician. Maybe they are. I don't know. What's the thing that they can do that you believe will say, okay, if you start doing this today, it will make you a stronger emergent leader tomorrow? What's that one thing or that piece of advice that you can offer our listeners?
Before you can be a leader, you have to be an educator. And before you can be an educator, you have to be educated. So never stop learning, number one. I continue to find out things every day that I've never even heard of, whether it be a new disease or process or something that maybe I forgot that I learned. And so number one is never stop learning. Do everything you can to get as much continuing education as possible and never stop. Don't get set in your ways. Don't get stagnant. And don't think that you know everything, because the more you learn, the more you realize that you know nothing.
Yep.
And so continue learning. As you do that, as you continue to digest all this information, then automatically you're going to become an educator, because you're then going to share that information you learn with others. And it's going to have a trickle-down effect. And as a result of that, that propels you into a leadership role as an educator. And so it just starts with taking in as much as you can and learning as much as you can, and remembering that medicine is always changing, and what you learned 5 minutes ago is no longer relevant. In fact, the medical textbooks we had, we were told these are already out of date when we started reading them. It's all old information. And so books are great. Read books as much as you can, but realize that take as much relevant online content as you can, up-to-date journals, and whatever you can. Just keep learning, and everything else is going to happen from there.
That's great. Well, I know that Fort Worth is fortunate to have you, and I am appreciative of your time today and spending some time with us and offering those words of advice. Thank you, Dr. Fairless.
Thank you. I appreciate your time. It's been fun.